Continuing with the Lindsay Clancy series, I wanted to give information about what a psychiatrist is. I've seen across social media that many people are not familiar with psychiatrists, physicians, or the medical training that they go through to get where they're at today. It all starts in college when pre-medical students perform extremely high academically. In addition to doing exceptionally well in their undergraduate classes, they spend hundreds and thousands of hours on volunteering, working, and research before ultimately taking the MCAT, one of the most difficult entrance exams of any profession. Being a pre-med student is like having a second full-time job that's even more difficult than being in college. I say this to highlight how early the high academic performance, dedication, and self-sacrifice begins in people who go on to medical school. Medical school is then 4 years long, and upon graduation, people receive their doctorate degree, which is either a DO or an MD degree. Typically, the first 2 years of medical school are focused on preclinical sciences. These are things like pharmacology, microbiology, anatomy, physiology, pathophysiology. Students are also exposed to all of the organ systems in the body and learn about the different specialties that exist that treat them. Medical students then transition to their clinical rotations for their 3rd and 4th years of medical school. During this time, they rotate through different specialties like internal medicine, family medicine, OBGYN, general surgery, neurology, pediatrics, and psychiatry. In their 4th year, they can do rotation specific to the specialty that they're interested in pursuing for residency. During clinical rotations, independence is strongly emphasized, and ultimately we're trying to get 4th year medical students to the point where they can evaluate a patient independently, present a plan, and we're able to follow through on that plan with little to no change from the attending physician. This means that by the time we transition to residency, which is typically a 4-year program and which is a 4-year program for adult psychiatry, medical students who are now physicians and have their medical degrees already start functioning and operating at a pretty high level and can be quite independent. They have supervising physicians, but again, the goal is constantly trying to see how independent these physicians can become. There's always oversight and their plans are always checked and assessed before they're followed through on, but the goal over these 4 years is to continue to develop that independence. In psychiatry residency, residents rotate through many different psychiatric specialties. They go through adult psychiatry, child psychiatry, inpatient psychiatry, outpatient psychiatry, forensic psychiatry, addiction psychiatry, and geriatric psychiatry. A lot of the emphasis is usually placed on inpatient psychiatry and outpatient psychiatry. In addition, they also typically do overnight call, weekend shifts, and will see patients in the emergency department, the medical floors, and the ICU when they have psychiatric needs. By the time a psychiatry resident is in their 4th year, they typically need little to no oversight. While it's still provided, the goal is for them to function essentially independently because that is what they're going to be doing once they graduate. Psychiatry residency can also be very demanding in terms of hours. While psychiatry residencies aren't necessarily as hour intensive as some other specialties, people still often work 60 hours a week, and in some residencies, people do hit the 80-hour cap each week. This means that by the time somebody is done with medical school and residency, they've had maybe like 15 to 20,000 hours of medical training and experience, which is all geared towards making them a very well-educated, very hardworking, and fully independent physician. Finally, physicians have to continue their education for the rest of their careers. For example, I have to read 40 articles every 2 to 3 years, and I have to take a quiz on every article. If I get more than one question wrong, I fail, and there's only a set number of articles I can fail before I have to take an exam to make sure I can still maintain my license. The exam is very arduous and is an all-day exam. So when somebody says that they recently graduated residency, they actually have an incredible amount of expertise and training at that point. They've been in school and have been working hard and sacrificing for 12 years after high school. I think that is very significant and something that we should not overlook lightly when we are judging new physicians.